Good evening, friends. I'm Dr. Vikram Khanna, and I'll be talking about research questions and research outcomes. A research question is a statement that identifies the phenomena to be studied. For example, does tip apex distance affect the outcome of DHS? A valid and clear research question is well justified, original, feasible, focused, and falls within the area of interest. Coming to the literature review and research question, this is a flowchart. Basically, if, identifying the two situations, whether I have a research question or I don't have a research question. Main difference is if I don't have a research question, I'll narrow down to a research topic, look for it in the literature, see whether the research question is viable, original, feasible, and if yes, then we have a research question. Now, if there is no research question, then where to start? Narrow down to an area of research. Within that area of research, try to answer a research question that has either not been addressed before, has been addressed, but you can extend it in a significant way, that is with a new data set or a new different theoretical approach, or pioneer a new area, research area of orthopedics, which is not recommended. Coming to the literature review, recent publications will contain more updated literature, so try to collect them first, then read backwards to the most dated study. Make sure that you read all relevant papers or at least the most influential ones. Ideas on research topic often come from this exercise. That is, if author X has not included factor Y in his study, so then factor Y can be included in your study. If there is a potential question in mind, then reviewing the literature will give us understanding whether the research question has already been answered or is a potentially valid one. Also, by reading previous studies, ideas can be on how to tweak the original research question into a brand new one can be gotten. Again, start by reading the recent publications first. Bottom line, whether or not there is a research question, it is crucial to review the literature first. Leaving the literature review as the last step is very dangerous, as you may find that the question has already been addressed or discarded by the literature because it may not be relevant, not important, not feasible. Now, where to search for papers or relevant literature? My esteemed colleague in the previous study has already discussed the same. Common mistakes when identifying new research question is non-originality, non-feasibility. That is, there may be a time constraint, as these research questions are basically there for a thesis. So there may be a time constraint because the thesis period may be restricted, obviously, and there may be a lack of resources, lack of money, or other data. Then there may be a lack of knowledge on how to do a particular case or particular surgical technique. Then too broadly defined research question or not well justified. So this is an inverted triangle on if you don't have a research question, then how you can go about it. First, think of a broad topic like management of IT fractures, then narrow it down that IT fractures, surgical management of IT fractures, then focus topic outcomes of surgical management of IT fractures using DHS, and then the research question can be outcomes of whether tip apex distance significantly affects the outcome of IT fractures using DHS. Now, tips of finding a good research questions are: start searching for the topic as early as possible. After narrowing down the topic, look for relevant literature. The literature research question should pass the literature review test. That is, has it been done already? No. Why not? And is it interesting or relevant? Ask the following questions. Is the question specific? Is it feasible? Are the resources available? Is the knowledge available? And are there any economic limitations to the study? If the answer is yes to all the previous questions, then we have a research question. Coming to the outcome measures, what is an outcome measure? An outcome measure is a result of the treatment or intervention that is used to objectively define the baseline function of a patient at the beginning of the clinical trial. Once the treatment or intervention has commenced, the same instrument can be used to determine the progress or the efficacy. Outcome measures should be measurable, which indicates that they should be a quantitative value. Now, coming to the primary outcome, defined as the outcome measures of greatest importance specified in the protocol, usually the ones used in the power calculation. Most clinical studies have one primary outcome measure, but a clinical study may have more than one outcome measures. The primary outcome measures are the main reasons why you are conducting the study. Secondary outcome measures, defined as the outcome measure that is of lesser importance than a primary outcome measure, but is a part of a pre-specified analysis plan for evaluating the effects of the intervention or interventions under investigation in a clinical study, and is not specified as an exploratory or other measure. A clinical study may have more than one secondary outcome measure. Other pre-specified outcome measures, they are defined as any other methods, excluding the post-hoc measures that will be used to evaluate interventions or for observational studies that are a focused that are a focus of the study. Exploratory endpoints fall into this category. Now, the post-hoc measures are the ones which have been specified after the trial has started. That is, during the course of study, we find that some interesting development has been taking place. Then we have to include it in the study. Now, coming to the considerations while selecting a study, the number of outcomes. A large number of outcomes may increase the chance of encountering issues. So keep it small, keep it simple. Considering the outcomes of that are clinically relevant, achievable, and address realistic research questions. Secondary versus exploratory outcomes. Appropriate secondary endpoints are often used to provide evidence that a particular mechanism underlies a demonstrated clinical effect. However, exploratory outcomes are the ones being used to frame future research and explore new hypotheses. This can be a separate last paragraph in your study, like, what do you expect the future of your outcomes to be. Then outcome measure description. What information is being collected and how is being collected needs to be pre-specified for all primary and secondary outcome measures. If a scale grading method is being used, then it should be pre-specified. Time frame, the specific time points and overall duration of the evaluation must be specified. For example, if we have to assess the functional outcome of a study, then we have to pre-specify that we'll be assessing it on like weekly basis, monthly basis, or 6 monthly basis. Not we can't keep it an arbitrary value. So it can be and it has to be pre-specified. If the outcome overall time duration can only be represented quantitatively, a specific numerical value should be included at the time of result reporting. Appropriate quantitative parameter for each outcome. Outcome measures cannot be reported as free text. It is allowed for the outcome measures to be involve qualitative information, but it should be also reported in quantitative measures. Thanks a lot for your patient hearing.